Good morning. Good morning and welcome, and thank you for joining us for our first post-election Power Hour, and to hear from Washington this morning about what the changes at the White House and in Congress will mean for our country. We're delighted to have you with us, and it's going to be a good day. Also want to give a shout out to our members who partnered with us and provided snacks and lunches to over 45 different polling places last week. And that was quite an undertaking, and providing lunches, as I mentioned, for poll workers and volunteers, around 45 different ones. Also, was wonderful to celebrate our veterans last week, and we're proud to be partnering with Hiring Our Heroes, which is part of our Low Country Jobs Now network. You can find that on our website, and I'd encourage you to check it out if you're looking for employees, or even maybe if you're looking for a career change yourself. We're focusing there on jobs for veterans, as well as encore workers, internships, and many more. Also, I'd like to mention that we'll be partnering with HGTV for their 2025 Dream Home, which this year will be in Bluffton. And to give you just a brief idea of what the popularity for that is, last year, there were over 130 million entries to win the dream home. And when on the live reveal, the evening that it was done, they had an audience of 4.9 million viewers for the reveal. So stay tuned for more updates on that. They were on Hilton Head Island a few years ago, and we're thrilled to have them back in Bluffton. Well, you've seen him before. You've heard him before on our Power Hour programs. You've also seen him on CNBC, Bloomberg, CNN, and a number of other networks. But we're delighted to have our good friend Neil Bradley with the U.S. Chamber back with us today. You might remember seeing Neil frequently during the pandemic, and then he's been on periodically since then. Neil's the Chief Executive Vice President and Chief Policy Officer, along with the head of strategic policy at the U.S. Chamber of Commerce. And Neil's just a super guy. We're thrilled to have him working at the U.S. Chamber of Commerce and leading efforts there. And we're also glad that he's a special friend of Hilton Head Island and Bluffton's. And Neil, I know you're glad last week is over with, and let's tell us what's going on and what to expect in the future.
Well, Bill, it's great to be with you again. Thank you so much. I have to admit, I woke up this morning, it was 31 degrees here in Washington. And so I wish I was with you and your weather. It's turning a little cold here. I am glad it's over. Maybe we all are, maybe no more so than the people who lived in those 7 swing states who just got inundated with relentless commercials, phone calls, door knocks, etc. I have to admit, there were some surprises last week. I think the biggest surprise wasn't so much the outcome of the election, but how quickly it occurred. I really anticipated that it would be several days before we might perhaps know the final results. And in fact, we got to go to bed at a pretty reasonable hour on election night, having a pretty good indication of where things stood. Obviously, an impressive victory for former President Trump, not just sweeping all 7 battleground states, but at the moment still winning the popular vote. 53 seats at the end of the day for Senate Republicans. That's a majority. And so it goes from Democratic control to Republican control. In the House, if you're following this closely, you know that it hasn't officially been called yet. But if you look at the districts outstanding, Republicans are going to maintain their majority in the House, but it's going to be about 222 seats, which is about where they are today, and 218 is a majority. And so, by the way, the biggest parlor game in Washington this morning is watching how many current House members President-elect Trump can take from the House for the administration, because it takes about 4 to 6 months to fill an open House seat. And so if he takes too many, all of a sudden Republicans wouldn't have a majority anymore. I don't think that's likely to happen, but it is the Washington's favorite parlor game. Let's talk a little bit about what we think this means in terms of kind of policy priorities. And let me start with some of the biggest ones. As you all know, we were heading into 2025 facing the largest automatic tax increase in American history. Come December 31st, 2025, major provisions of the 2017 tax reform bill automatically expire. In net, about $4.5 trillion in automatic tax increases. Importantly, if you're a partnership or an LLC or a sole proprietorship and you pay your business taxes through personal income taxes, your top marginal tax rate would have gone from 29% or will go from 29% to 39% overnight. And we've been gearing up to figure out how we navigate kind of this challenge. The unified Republican government means that Republicans will be able to use a process called reconciliation, where they only have to get 51 votes in the US Senate. There's no filibuster to be able to address that tax cliff. And so this is the same process that was used in 2017, where Republicans also had unified government to enact the tax reform bills. And so we're confident that we're going to avoid that automatic tax increase. There's still a lot of work to do, as you saw on the campaign trail. President Trump has some new ideas on the tax policy side. There's a whole bunch of new members. Fully 60% of the members of the House have been elected since 2018. And so tight margins, a lot of work to do, but we feel confident. Regulations. One of the things that we've spent the last 4 years doing is really fighting the regulatory overreach of the Biden administration. We've sued them 14 times alone just this year. President Trump and a unified Republican Congress have the ability to roll back a lot of those regulations. Some of it will happen quickly using special expedited processes for recent rules. Some of it is going to take months and in some cases years to roll back as they have to go through new rulemaking processes. But the direction of travel is going to be positive. All of the uncertainty that's been created around competition and antitrust policy will go away. This won't be a problem for you in South Carolina, but it will be a problem for the nation and for companies in other states. We are watching some of the progressive states indicate that they're going to simply pick up those regulatory and antitrust policies of the Biden administration that Trump is rolling back and impose them at the state level. If you operate in those states, that obviously creates new hurdles. But in general, it's great news on the regulatory front. There's a couple areas where I think the business community is going to have to navigate. First and foremost is tariffs. You've heard President-elect Trump on the campaign trail talk about tariffs in a whole bunch of different ways, almost all positive. Sometimes he talks about them as leverage. Sometimes he talks about them as a revenue source. We know that tariffs are taxes on American consumers and businesses, that they really do impact retailers. They especially impact people who are manufacturing in the United States and may have to import parts. And so we don't know exactly where the president's going to go on tariffs, but we're making the pitch to him and to the administration that we have to be really careful here. Taking on China, dealing with the national security threats, unfair methods of competition, we're supportive of that. The kind of broad-based tariffs would really counteract all the other good things that we have going on in the economy. The last I would say is workforce. If there's one thing that's maybe really different today than it was when when President Trump took office the first time 8 years ago, it's that we are today in a chronic worker shortage across the United States. And so as we think about the challenge of controlling the border, which he's absolutely going to do and needs to be done, we're very focused on doing that and figuring out how we expand legal immigration. And here you've heard the president talk more favorably towards legal immigration than maybe he did 8 years ago, although some of his advisors are kind of still taking the opposite approach. We're going to be working, because we think this is something that Congress is really going to have to tackle, to figure out how we both secure the border and raise those levels of legal immigration. Because if you combine more people entering the workforce legally, the right tax policy, and getting regulations right, we really do have the opportunity to sustain the kind of economic growth that we're hoping to see. One last thing, and I'll just end here, and I may have 1 minute for questions, and I apologize, but I have to run to a 9:30. Yes, Republicans have unified government, but there are still limitations, really tight majorities. You still have a filibuster in the Senate, and you need 60 votes. So you will hear kind of wild expectations about all the things that are going to immediately start passing in Washington. Um, my advice is to temper that. It's still Washington. It's still really hard to legislate. You still have to build coalitions. And so that's the work that we're about doing. And we're so excited to be able to partner with Bill and the team there to do just that.
Thank you, Neil. Thank you. Maybe one question before you need to run?
Please, yeah.
Yeah, that question's coming from Karen, and Karen is asking, what's your outlook based on the election on healthcare and Social Security changes?
I don't think we're going to see any Social Security changes. That the president-elect's kind of taken that off the table. Healthcare, I wouldn't buy the hype that you're seeing some places about a complete revisit of the ACA. A big question is that there were enhanced subsidies for the Affordable Care Act that were enacted in the Biden administration. Those expire at the end of 2025. I think a big question is, what does this Congress do with those? And that will definitely impact insurers, providers, hospitals, and it's something we're watching, and we want to make sure that Congress gets right. And so that's probably the biggest policy change on the horizon.
Neil, we know you got to run. Thank you for being with us. Quick update, and good luck on all things at the intersection.
Any questions you get afterwards, send my way, and you and I'll coordinate, Bill, and we'll get people answers.
We'll do it. All right, sir. Okay. Have a great day.
Thank you. You too.
Thank you. All right, that was Neil Bradley, the Chief Policy Officer at the United States Chamber of Commerce. We're going to circle back a little closer to home now, and we're thrilled to have with us Russell Baxley. Russell is the president and CEO of Beaufort Memorial Hospital, and is certainly doing some very, very interesting things at Beaufort Memorial Hospital as it continues to grow. And today, the particular topic we're going to be talking about is what I like to term as essential housing or workforce housing. And what Beaufort Memorial has done is certainly unique. And Russell, we're looking forward to having you talk to us about that this morning.
Yeah, absolutely. Thanks, Bill. Appreciate you guys having me. And what a great segue. Mentioned workforce shortage across the nation, and we're talking about workforce housing, which is something that I think helps address the workforce shortage issue. And I think, while not unique to Beaufort, maybe a little bit more pronounced to the Beaufort County area, given the cost of living in this area, mostly driven by housing and childcare, and both are near and dear to Beaufort Memorial's heart. But I think today we'll focus a little bit on housing and really 4 projects that we've kind of taken up as opportunities to maybe provide workforce and innovative housing opportunities and unique and different partnerships, both with the county, several municipalities such as the town of Bluffton and the town of Beaufort, as well as private developers like Woda Cooper companies. We've kind of started being the convener, if you will, of a number of different owners of this project to say, how can we all come together and really create something unique and special in Beaufort County, maybe create almost a playbook that others can follow. But I think one that is most ready and is announced and we're kicking off is a multifamily housing project, the Livewell Terrace in Bluffton and Buckwalter Place. As you guys know, we're looking to break ground on a new facility there in January. And as we do that, and as we need to recruit more people to work with Beaufort Memorial, we got to find them places to live that are affordable. And so we have worked with the county to secure and acquire land in a partnership there. We've contacted and have an agreement with Woda Cooper companies as a affordable housing, workforce housing developer based out of Ohio, but they have several assets in the Savannah and Beaufort and Charleston marketplace, so they know the area well. And we've working with the town of Bluffton to secure 120 RDUs to build this facility and or this multifamily complex. And it has a unique twist on it because we're a healthcare provider. We also want to expand healthcare as well. And so we've secured and acquired the land with the county. uh, Wodo Cooper is actually going to build the 120 units in a combination of 30 one-bedroom, 62 bedroom, and 33 bedroom units. And then we're going to build healthcare on the site, mostly focused on primary care and access to care as the site is coming together. So we're very excited. It's kind of this live, work, play concept that we put together, and ultimately, working with Woda Cooper has been very helpful because that's their strength. Right? Their strength is workforce housing and these developments, and in particular, they know how to navigate at a state level applications for, say, housing tax credits. And here recently, we were successful in securing a housing tax credit from the state. I think we were one of 5 successful applicants out of about 40 that submitted for this round of funding. And otherwise, without that tax credit, I don't think this project would be successful. And so the goal is breaking ground within the next calendar year as we work right now with utilities and access management and master planning of the site with the town of Bluffton. So still really a long ways to go, but I think a nice first step in what is 4 projects for Buford Memorial that we're working on. Another project that we're currently working on with Woda Cooper, a similar concept, but it's land that we have owned for a while. And so what we're taking is Buford Memorial owned land, leasing that to Woda Cooper. Again, working in this sort of live, work, play sort of concept where we will apply again for a tax credit at the state at the next round of funding with the goal to build a multifamily project with 70 units. But this multifamily accomplishes 2 things outside of the housing units themselves. It will be a child care center. So we currently have a location here on our north of the Broad campus, as we call it, the Beaver Memorial, that houses about 100 children for our employees for affordable child care. We want a location south of the Broad River. So this multifamily complex will have one location or one spot in it that has our second child care location, early childhood education, and then also another opportunity to grow primary care access and a clinic that will be on this site. So, Woda Cooper is really taking care of the site work and the core and shell, et cetera. We're doing providing the land and then the fit out of the areas that we would maintain in child care and how and primary care. But again, just a really unique way of kind of attacking this affordable housing issue. You take the cost of land out of the equation for the developer, you add in the housing tax credits. All that is helpful for meeting the 40, 60, 80 AMI threshold, so to speak, keeping the cost as low as possible back to the employee or any others in the community that could take advantage of this. And at the same time, Beef Memorial is getting shell space to enhance access to primary care in the area, as well as allow for an additional child care site, which again is important to our workforce. If I flip kind of to north of the Broad, we're looking in particular at 2 projects, but these take less of a feel and flavor of a multifamily kind of large apartment complex where you're mostly seeing renters, and we're really focused a little bit more on ownership, home ownership. And so we've got 2 sites that we're currently working on that would look more like single family homes and townhomes in which we're putting up some dollars specifically to acquisition of land, site development, working with utility companies, the county, the cities on other impact and tap fees, et cetera, making these sites somewhat pad ready, if you will, and then working with nonprofit organizations, banks, and others for somewhat these first-time home buyer assistance programs, et cetera, to maybe look at how do we allow employees a pathway to home ownership. One site in particular, we've reached out to Clayton Homes, based out of Tennessee, and they're very much excited about looking and helping us develop kind of a modular home concept and some infill type opportunities in the city of Beaufort that we're currently working through the pre-approval process. But again, same concept as we work with a home manufacturer. We look at some of a modular home concept. We work with them to build kind of in bulk and then build these homes on land that Beaver Memorial's own, and then work on, how do we create opportunities for either rental opportunities for employees or those in the community or home ownership. I mean, we'd very much encourage and would like to say, hey, we'd love for you to take the opportunity to purchase these homes, and work with us on that. So really kind of have a mix of about 4 projects. Some are more focused on very large complexes that are mostly focused on renting. And then we have a few smaller projects that are very much focused on, how do we create home ownership? How do we help our employees build wealth, have a home as an asset, which we think is important, and allow them to have a choice, right? Which pathway, how would you like this to look for you, and let us help you get there, which is really back to the how all this originated, which is our PATH program, which is people achieving their highest. We've announced a lot about our nursing school with the University of South Carolina Beaufort, our PATH program, which has graduated 100 plus people in different roles, such as patient care techs and certified medical assistants, et cetera. But another leg, so to speak, of this kind of three-legged stool was looking at the cost of living, making things more affordable for employees, and helping them understand how to navigate this very complex financial world. And housing was one of those opportunities. And so maybe unique to healthcare and seeing a hospital kind of step into that role, but we're excited about it. We think it's the right thing to do. And again, we think that if some of these projects are successful, that it is a opportunity and somewhat a playbook that we create that we're happy to share with others to say, hey, this is a path forward that maybe you could recreate in trying to address the affordable housing situation. So a lot of these projects feel a long ways off. At one point, the Bluffton project felt a long ways off, but it's becoming more of reality. And man, we're excited to build this project and kick it off and cut the ribbon a year and a half, 2 years later on 120 new units in the Beaufort County area. Um, Bill, let me pause there and see if there's any questions or any other commentary that maybe I can add.
Okay, great. We have some questions coming in. And first of all, thank you for the update. Before the first question, I'm going to ask, early on in your career, is this a type of discussion you ever thought you would be having, or types of initiatives you would be leading or creating or having the great ideas to implement?
No, I mean it's a good question. I will tell you, prior to COVID, right, when it feels like healthcare was turned upside down, and we're still trying to navigate some of this post-COVID environment. No one in healthcare would have told you they were thinking about housing or a nursing school collaboration with University of South Carolina Beaufort, or childcare for that matter. Especially kind of community hospitals. Maybe the very large tertiary care centers in the major metropolitan areas. That may be a different story, but community hospitals such as Beaufort, I mean, this would never have been on the radar. And obviously, it's nothing we've been trained for. I mean, I will tell you, I am very bad at uh, housing and developments. Is not what we do. It's not what I've been trained for. And so I learn something new every day. And that's why I think it's important to have very good partners to help you along the way. Because again, this is not what we do on a day-to-day basis, but very important. But no, not in a million years would I have told you 5 years ago that we'd be talking about 4 housing projects in Beaufort County.
Well, you certainly have gotten it down and adjusted and learned to it very quickly. We have several questions from our viewers, and I've continued to ask and remind if others have more to please put them in the chat box. The first one, Russell, is from Andrea, and Andrea is asking, what is deemed an affordable monthly rate for housing for a family of 4?
Well, it's a good question. It kind of, I would say, aligns more with the rules around affordable housing and the housing tax credits and the area median income. And I would need to go back and look specifically at where the AMI sits today in Beaufort County. But for example, a 3 bedroom on kind of a sliding scale, and again, a sliding scale, whether you're at the 40th, 60th, or 80th percentile of the AMI, it will look different for the different families. But I would give a range of a family of 4. I think the ideal goal in a 3 bedroom apartment would be somewhere between the $1,200 and $1,400 a month range for a 3 bedroom apartment. That is ultimately where we would like to land if I kind of give you a range. And again, that may look different based on your income, but that's ultimately kind of a safe number that I could say that's where we'd like to be in most occasions.
All right, thank you for that. Bob is asking, what is the criteria to be eligible for the workforce housing?
Is back to that criteria where you fall on the area median income for Beaufort County, and how many units that we have to designate at each of those levels, the 40, the 60, and the 80. And so it's going to be a mixture of such. And again, I wish I had my notes in front of me from the last housing project, but I think the area median income for Beaufort County was around that 70 to $80,000 range, I believe, last I checked. And so the criteria would be for, I would say, 80 to 90% of the units, you would be at the 40, the 60, or the 80th percentile of that. There will be some units that would fall outside of that would be allowed. But that's kind of the criteria to meet to be in the affordable workforce housing projects that accept housing tax credits. If the projects, and so for example, the two projects in Beaufort would not be using housing tax credits, they would not otherwise qualify. The criteria can be, I would say, less stringent, and more, I would say, flexible in how we approach kind of who qualifies for those units.
All right, thank you for that. Pamela is asking, what's the biggest challenge when it comes to recruiting nurses to our area? And in addition to housing options, what are you doing to recruit them?
I mean, cost of living is the biggest challenge. I mean, across the nation, there is a nursing workforce shortage. Last couple of surveys, there's a couple of different surveys slash studies that have been done specifically on the state of South Carolina, but we typically hover somewhere within the top 10 for the worst nursing shortage in the United States. And so I've seen that number in the last couple of years range anywhere between 5,000 and 10,000 nurses short by 2030. That's a lot of nurses for the state of South Carolina. And so we're all working to recruit more nurses to the area. I think outside of housing, I mentioned childcare. That is a big plus that we have an employer-sponsored childcare, one that can have flexible hours, and also one that looks and maintains the same sort of holiday schedule and storm schedule as the hospital, so to speak, that we remain open when other child cares are closed. And again, it's affordable. It is, anywhere between a 20% discount to a 50 to 60% discount, again, based on a sliding schedule for our employees based on what you'd otherwise see in the marketplace. And so that's been very helpful. Competitive pay is really kind of a no-brainer that we're all struggling with as employers, right? Regardless of which industry you're in. We have to be competitive pay and keep up with how the market escalates. And then other benefits are important, and also maintaining that work-life balance. I mean, as you recruit more younger nurses or physicians for that matter, there's more and more wanting and wanting to understand how do you provide for a work-life balance. And I can only speak for healthcare, but I can tell you healthcare and hospitals in particular, which are 24/7, we have historically struggled with work-life balance conversations. And so every day we're talking and trying to figure out how do we provide for better work-life balance for our employees.
Thank you. Next question is coming from David. And David is asking, what role do you see Beaufort Memorial playing in the community as the healthcare landscape continues to evolve, especially with the growing emphasis on preventive and long-term care?
Yeah, I think first and foremost, our role is to continue to expand access to primary care. I think if you look and specifically drill down on our medical staff, I think you'll see that we have one of the largest primary care group practices in the area. We employ 50 plus primary care providers, all of which have very full patient panels. And so I think the first thing we have to do is continue to focus on recruiting more primary care providers to the market. I will tell you that we always have a goal of starting 2 to 4 new primary care providers, nurse practitioners, physicians, and physicians in the Beaufort County area. And most years we're successful. Now, unfortunately, we recruit 4 and 2 retire, or one might go concierge, which, if you're traditional primary care and you decide to move to a concierge model, you pick up, you take about 500 patients with you, but there's another 1,500 patients that don't otherwise are able to stay with you as a provider. And so they're looking for a new medical home. You increase that with, or you take that and you add on all the added growth we're seeing in the Bluffton, Beaufort, Hilton Head marketplace. And, you kind of got a double-edged sword there, and it creates constraints and access issues within the network. And so we continue to recruit. We've got a plan over the next 2 years to recruit 8 new primary care providers to the area, 4 in what we call the Beaufort Ladies Island area, 4 in the Hilton Head Bluffton area. We have a new practice location we're building at the May River Crossings area in Bluffton that will add more primary care to the marketplace. And then we're recruiting, others that, are not more traditional primary care, but maybe are looking at more your geriatric type providers that are looking at long-term care and specialize in an aging population. Those are harder to come by, those that specialize in geriatric medicine, so to speak, and in sort of that older population. But that is something we're also exploring, and how do we expand access to that above and beyond just your general internist that we might otherwise recruit in the outpatient world. So, those are our 2 big focuses. And then we have some other things that we're looking at in terms of our home health partnership. How do we expand that with Amedisys? We are part of a home health company, but we think there's opportunities there to bring care, especially for an aging population, bring more care into the home, which we think is important.
All right, thank you for that. Let's see. Cindy is saying that Live Terrace is a step in the right direction to workforce housing, the workforce housing shortage. Congratulations for leading the way. That was from Cindy. Next question's coming in from Jonathan. And Jonathan's question is, with the development of your new medical facility in Bluffton, what are the biggest healthcare needs you're addressing in our community?
I think just more provider recruitment. I think we need to build a larger, more diverse medical staff. I know that we continue to struggle with certain subspecialties such as gastroenterology, neurology, I would say vascular surgery is an opportunity to increase urology, another opportunity. And so, I think as we expand as an organization and health system and create more time and more operating suites for specialists to practice in, it allows us the ability to recruit them to the market, gives them a new hospital to see patients and do the work that they're supposed to do. And that's important. Because I will say, for example, Beaufort Memorial, we are right now undergoing an OR renovation, but we have no OR time left. We've recruited a number of surgical specialists to the area, and we struggle to help them find operating time. And so we need to build another facility so we can add more ORs, so we can recruit more providers. We also know that certain people want to live north of Broad, certain people want to live south of Broad, and having an organization, having another facility south of the Broad allows us to recruit and have our providers live, work, and actively be in the Bluffton Hilton Head market and practice closer to home versus coming to Beaufort Memorial and Beaufort. So I think that's important as well, to expand access to care within the community. So that new location is just going to allow us to recruit more specialists to the market, and just increase access to care. Because again, I know that we already this year have probably 4 or 5 subspecialists retiring at the end of this year who are already retired, which is going to create constraints for patients that are used to seeing those specialists that no longer have that home, that we're going to have to figure out collectively together.
Last question we have coming today is from Charles, and Charles is asking, with the rising healthcare costs, how are you balancing affordability and accessibility with the expansion of services and facilities in Bluffton and surrounding areas?
It's a really good question. I'll start with primary care and back to a very good question about preventative care. I mean, I think the first thing is we reduce the cost of healthcare by keeping people out of the hospital. And ultimately that starts in the primary care home. And so we've got to expand primary care to allow people to have access to care and keep them healthy and otherwise away from the larger, the higher cost areas. We're here when you need us, and hospitals are very important to the healthcare ecosystem, but it is the most expensive place to receive care. I think also what you've seen Beaufort Memorial do is expand access to care through different levels of urgent care. There is the ER, but the ER is appropriate for those higher level sort of emergent visits. But you see a lot of people using the ER as where otherwise an urgent care can be used. And so we have 3 urgent cares in the area, which is a 12-hour location at a lower cost of care that's convenient and accessible, that can see probably 30% of actually what arrives in the emergency room. So we focus not on just emergency room care, but urgent care, primary care, and then we do partner with Publix on telemedicine. Telemedicine is another opportunity and the lowest cost of care for urgent care and access to primary care visits. So we really truly believe that right care, right time for the right price. And ultimately, that's why we've taken this approach of telemedicine, primary care, urgent care, and emergency care. We need to expand all four in order to give our patients access to the right cost of care. And so that's really kind of what we've taken the approach of. And then, as we build the facility in Bluffton, I think what you'll see is we're not overbuilding. I think we're building a appropriately sized facility that will be able to take good care of the community. But if you overbuild, somebody has to pay for that at the end of the day. And so we want to take care of the monies we are borrowing to build facilities, that the right facilities, right, and the right size to appropriately care for the community. And so we've always been cognizant of that as we build, is building what is needed and not what is not needed, because that just increases the cost of the facilities that we build.
Russell, we've had a couple other messages just while you were talking, and both of them were just thanking you for your creativity and leadership on these initiatives. So congratulations on that. We really appreciate you being with us this morning, sharing some very, very valuable information. And we look forward to watching the projects come together and how the region continues to grow. So thank you so much, Russell.
Thank you guys so much for having me. I appreciate it.
Russell Baxley, President and CEO of Beaufort Memorial Hospital. Thank you. Everybody have a good week. We're glad to have you with us. And please reach out if there's anything we can do to further assist you with. Have a great week. Bye-bye.